Frequently asked questions about ALS.
Callie, what is ALS?
ALS stands for amyotrophic lateral sclerosis. ALS is a disease that affects the nerve cells in the brain and spinal cord that control voluntary muscle movement. It is a progressive disease, meaning that the nerve cells continue to degenerate over time until they eventually die. When this happens, it becomes difficult for the person to initiate and control muscle movement. ALS can eventually result in total paralysis, difficult breathing, and death.
Anna, who gets ALS?
According to the ALS Association, as many as 30,000 Americans have ALS at any given time. Because it is a relatively rare disease, records are kept regarding characteristics of those who have been diagnosed. This database shows that approximately 60% of people with ALS are men and that 93% are Caucasian. The majority of people who develop ALS are between the ages of 40 and 70, with an average age of 55 at the time of diagnosis.
Callie, how is ALS diagnosed?
Like many other neurodegenerative diseases, there is no singular test that can identify ALS. Instead, diagnosis is a complicated process of ruling out all other possible causes for the person's symptoms. This process can involve electrodiagnostic tests, blood and urine tests, imaging such as an MRI or X-rays, a spinal tap, muscle or nerve biopsies, and a thorough neurological exam.
Callie, how is ALS treated? Is there a cure?
There is no known cure for ALS, but a medication called Riluzole has been found to slow the progression of symptoms in some people. Other medications may be used to treat specific symptoms. Additionally, other physical therapy and rehabilitation interventions can help with some of the functional mobility issues that arise as the disease progresses.
Anna, what resources are available for people with ALS and their families?
The ALS Association maintains a page on its website for people with ALS and their caregivers. The page connects families with reading materials, videos, support groups, clinical trials, and volunteer assistance through local chapters.
We're here today with Anna Dennis, a relative of a victim with ALS. What were some of the symptoms that you witnessed?
Well, my Uncle Phil was mostly bedridden within the first year that he had ALS, and he lost a lot of control over his muscles. So for the most part, he had face cloths in his hands, and he basically just rested his hands on the bed. He really couldn't move, he couldn't bathe himself, he couldn't feed himself. So my aunt would try to take care of him along with my cousins, but they also had like a nurse that helped out with bathing and feeding.
How old was he when he was diagnosed?
He was 50.
And how old was he when he passed away?
52.
Okay, so only 2 years with it. How did his disease progress?
Like I said, within the first year he was bedridden, and so basically it progressed very quickly. In a lot of cases it does. So when he was diagnosed, it was really slow at the beginning within the first couple months, but within the first year that he had it, my family had a room set up with basically like a hospital bed and had nurses helping him because he couldn't do anything on his own.
So how did the family cope afterwards?
It was actually amazing how well everyone dealt with it. My uncle was definitely one of the happier, funnier people in the family, so it was obviously very sad, but everyone visited him a lot. And my aunt, his wife, is a twin, so her twin sister and her husband helped out a lot, and my cousins actually helped out a lot. They visited him, and of course it was really hard losing him, but I think we dealt with it very well.
How did he communicate with you guys?
So my uncle, he really couldn't talk, and my other uncle would have a laminated sheet of paper with letters on it, and my uncle would point to the letters, and my Uncle Phil, who's the one with ALS, would either like grunt and try and say like yes or no, and it would obviously take a really long time for him to get the sentence out, but my Uncle Jack was very, very patient with him and helped a lot with trying to convey what he was trying to say.
Okay. Well, thank you for your time.
Called Razzulo has been medication called Relul. I can't do it.
Reluzol! I'm gonna ask Callie.
Specific symptoms.
Callie!
Wasn't me this time.
We need to